To any healthcare professional who has the wisdom and insight to understand what the information they are being presented with can mean to their community, their patients, and of course, the bottom line of their balance sheet. Hyperbaric oxygenation therapy and the opportunities that are available to you. How hyperbaric oxygenation therapy works. Oxygen stands as the key substrate for metabolism. Every day, an average adult consumes 3 pounds of food, 3 pounds of fluids, and almost 6 pounds of oxygen. From that 6 pounds of oxygen, about 2 pounds get into the blood for transport to tissue cells. Oxygen completes the energy cycle that sustains life. Many serious health problems stem from or are complicated by tissue hypoxia, low oxygen levels. Oxygen under increased pressure can correct this deficiency. To provide this increased pressure, one must go completely inside a hyperbaric chamber. Modern engineering makes these chambers comfortable and safe. When you breathe oxygen while inside a hyperbaric chamber, the natural state of oxygen does not change. Green plants produce the oxygen. Modern technology increases the pressure. This does not change the molecular composition of oxygen. Increased pressure just allows oxygen to get into tissue better. Medical education taught physicians to think oxygen causes oxidative damage. On the contrary, a lack of oxygen causes that type of damage. Contrary to popular misfortune, oxygen protects tissue from free radical damage. Hypoxia creates oxygen-free radicals. An inadequate oxygen supply to tissues results in the catabolism of ATP to adenosine and the creation of an electron donor. Hypoxia causes a cascade of interreactions that generate hydroxyl ions that damage membranes and draws calcium into the cells. Lactate acidoids from hypoxia points to hypoxia tissue damage. Correcting hypoxia will limit this free radical formation. Perfusion injury occurs after an episode of poor circulation recovers but with poorly oxygenated blood flow. If the patient gets hyperbaric oxygenation, a dramatic reduction in reperfusion damage occurs. Throughout the 20th century, medical care limped along with limited access to this helpful oxygen therapy. As we enter the 21st century with greater public awareness, along with more hyperbaric chambers available, we see less acceptance of failed outcomes. The first pressurized room used to treat health problems was built by an Englishman named Henshaw in 1662. However, it was not until over a century later, in 1788, that compressed hyperbaric air was put to large-scale use in a diving bell for underwater industrial repairs of an English bridge. The first deep-sea diving suit, invented in 1819 by Augusta Sibb, used compressed air supplied to the helmet for generous underwater movement. A French iron shop in 1834 built the first hyperbaric tank under the direction of Dr. Junod. A copper spear 5 feet in diameter with the appropriate viewpoints and compressed air fittings became the center of attraction for many patients. He reported recovery from a variety of debilitating conditions in the Bulletin of the Academy of Medicine. Hyperbaric enthusiasm spread among the European countries during the next 40 years. 6 people came from America to try the new therapy. An enterprising Canadian built the first North American hyperbaric chamber in 1860. Early French enterprising hyperbaric associated surgery demonstrated that patients recovered with fewer complications. This interested the European medical profession. Dr. John Say Halliday studied the effects of compressed oxygen and taught at the University of Dundee in the early 1900s. He developed the first diving tables for the Royal Navy. His legacy came It gives him the title of Father of Oxygen Therapy, and physicians continue in his line of work to this day. In 1918, Dr. Orville Cunningham considered the differences between people living or dying through the flu epidemic in the Rocky Mountains. He noticed people in the valley fared better than people in the mountains. He reasoned that denser air in the valley helped people fight the infection. He had an 8-inch diameter by 30-inch long hyperbaric chamber built next to, that's 8 feet in diameter by 30 feet, built next to his medical clinic. Good outcomes with the patients suffering from pneumonia encouraged him to build other chambers. He built the world's largest functional hyperbaric chamber, a 64-foot steel sphere hyperbaric hospital with 5 floors of living space. The Great Depression in the 1930s ended his project, and the steel was scrapped for the war effort in the 1940s. Harvard Medical School has had a hyperbaric chamber built in 1928. It proved a university-based medical research program. In the last 4 decades, great strides in research has raised the value of this unique therapy. University studies have expanded the list of conditions usefully treated with increased pressure oxygen. Doctors used to ask, can it work? Now they ask, how much is needed to completely work? Does hyperbaric oxygenation help in pain management? Related to crush injuries, it is apparent that much pain is a result of tissue swelling around sensitive nerves. Hyperbaric oxygenation acts internally to reduce tissue swelling. For example, a patient with a burned leg from her knee down to her toe had blisters that covered her leg, second-degree burns, and the pain was excruciating. After 30 minutes into her first hyperbaric session at 2.5 atmospheres, she reported her pain stopped. She completed 15 hyperbaric sessions, and within 4 weeks she healed with no scar formation. Many serious health problems have various forms of ischemia. When ischemia is severe and persistent, it may lead to an anaerobic form of tissue metabolism that may perpetrate the entire process. Reference W. Boyd, A Textbook of Pathology, 8th edition, page 69. Hyperbaric oxygenation may provide relief. Hyperbaric oxygen treatment enhances the recovery of blood flow and functional capillary density in post-strated muscles. In 1993, Circulatory Shock, chapter 49:13, these research findings indicate that hyperbaric oxygenation has a place in treatment of more pain syndromes. Safer than flying. Do people feel different inside a hyperbaric chamber? Chamber atmosphere pressurization occurs slowly to allow adjustment of ear pressure. As the pressure increases, the occupants just yawn, swallow, or blow their nose to clear pressure changes in their ears. Other than this ear pressure, there are no unusual or different sensation. A hyperbaric oxygenation session allows us time to relax unless one has anxiety about being inside a chamber. Even some people with claustrophobia and anxiety find that once they start breathing oxygen, their anxiety clears and they enjoy the session. The hour invested inside a chamber provides a place of safety for healing to occur. The nearest experience resembles sitting in an airplane. Passengers seldom think about changing cabin pressure when they fly. As a jet ascends 40,000 feet, high compressors pressurize the fuselage to keep passengers safe. But at what pressure? Outside, the jet air pressure stands at little more than 2.5 psi. A human would quickly pass out and soon die at that low pressure. At sea level, we breathe an absolute pressure of 14.7 psi. In the jetliner, we survive with about 11 psi, lower than normal pressure. This lower pressure resembles the altitude of a mountain between 7,000 and 8,000 feet. At that altitude, the oxygen level in our body tissues drop, and some cells risk reduced function. In some blood vessels, especially in the lower legs, the lower oxygen pressure weakens cell activity and may lead to thrombus formation, clots or clumps of exhausted blood. This thrombus may detach later and clog a vital tissue area, leading to death, usually after the jet has landed. In the past, when these victims died away from the airport, few people made the connection to the long flight as the cause. Some airlines now encourage leg exercises during flight. This suggests the problem stems from just inactivity. However, it really stems from the lower pressure in combination with inactivity. On long flights, we should move our ankles, often get up and walk down the aisles, breathe and stretch. Breathing inside a chamber with higher than normal air pressure would prevent and reduce tissue congestion. Jet design does not allow pressurization of the cabins with higher than normal air pressure, so just do the best you can. Lower pressure kills, as the vacuum of the space demonstrates. If a spacesuit ruptures, the occupant's blood will boil right out of the body. Talk about extremes. Low pressure can hurt us. Higher pressure can heal us. The real question involves access to the hyperbaric equipment. We need more chambers for more access to this very helpful therapy. Imagine a therapy firmly grounded in science, safer and healthier than flying. Let's look at getting a chamber for your clinic. The following are just some of the conditions which may benefit from hyperbaric therapy, and they include ADD, ADHD, arthritis, autism, asthma, allergies, acute mountain sickness, brain injury, Bell's palsy, cerebral palsy, Crohn's disease, fibromyalgia, frequent air travel, hypoxia, Alzheimer's disease, Parkinson's disease, anti-aging, multiple chemical sensitivity, joint and pain, loss of limb, lupus, immune deficiency, multiple sclerosis, sports injuries, stroke, surgery pre and post, wound healing, diabetes, circulation problems, headaches, acid stomachs, candidiasis, body detoxification, skin disorders, sleeping disorders, and Lyme disease. In Figure A, below, the brain belonging to an autistic child was scanned. The areas of dark blue and purple indicate low blood and low brain activity. After receiving hyperbaric therapy for 10 sessions, the same child was scanned again. Figure B, to the right, shows the areas of yellow, red, and white, and they indicate higher blood flow and greater brain activity. Hyperbaric oxygenation therapy and the opportunities that are available to you.